There's been a stigma against the use of psychedelic drugs in the United States since the beatnik era of the 50s and 60s, due to its rampant and unregulated use at the time. However, new research proves that the controlled use of psychedelics can be used in numerous therapeutic applications. It can benefit those who struggle with substance abuse, certain mental disorders, and can even improve normal social behaviors.
You may be wondering how these drugs work. Well, hallucinogens primarily affect the brain's cortex, and the cortex operates using a combination of signals induced by chemicals like serotonin. But when using psychedelics, those signals are disrupted, altering the user's mood or perception.
There is recent evidence that controlled doses of specific psychedelics like LSD or psilocybin mushrooms can be used to treat alcoholics as well as those who are nicotine dependent. In fact, researchers from Johns Hopkins conducted a study in 2014 that tested the therapeutic application of psilocybin on nicotine addicts. 80% of the participants quit smoking 6 months after 3 controlled doses, which is a far higher rate of success compared to any other smoking cessation methods like nicotine replacement therapy.
And hallucinogens don't just aid substance abuse victims. They also provide benefits during everyday social behaviors. Responsible recreational drug practices can increase social confidence as the stimulant's effects on the neural pathways relax us, making us kinder and calmer. A practice called microdosing, where you take minuscule doses of psychedelics, has positively impacted spiritual and professional growth in test subjects, prompting them to be more creative and open-minded problem solvers. Though there are few formal studies conducted on these social and professional experiences, many swear by this practice, including Steve Jobs, who frequently used LSD recreationally. He said that taking LSD was a profound experience, one of the most important things in my life, and it inspired him to focus on creating great things instead of making money.
Of course, hallucinogens are limited to everyday social uses. They can be used to treat a number of mental disorders, specifically anxiety and depression. There have been many clinical trials testing the benefits of psilocybin and LSD on mentally distress. And some researchers claim that depending on the patient and the quality of the dose, anxiety can be alleviated even after one dose. One study was conducted over a few months among cancer patients suffering from both anxiety and depression. They were given a controlled dose of psilocybin as they were monitored by 2 doctors. And afterwards, nearly all participants involved felt significant positive changes in their mental health and stability.
Despite all these newly found benefits, the prescription of psychedelics is still only reserved for clinical trials. The trepidation for doctors to endorse the use of hallucinogens stems primarily from a lack of data, as progress in research is often obstructed by regulations from the federal government, such as the need to gain permission from the government when using controlled substances like LSD, or being forced to use small sample sizes, which is exemplified by a previously mentioned study on the therapy for nicotine addicts, which only had 15 participants. These inefficient approaches to research result in gaps in knowledge in regards to finding proper dosage quantities, resolving issues of tolerance development without resulting to drastic increases in dosage sizes, and the inability of specialists to make prescriptions based on varying gender, body mass, family history, and other factors. This insufficient data also provides little aid in the treatment of some hallucinogens' known adverse effects, like psychosis and hallucinogen persisting perception disorder, or HPPD. Both include harmful symptoms such as visual disturbances, disorganized thinking, paranoia, nightmarish feelings of anxiety, mood swings, and thoughts of suicide, making any ill-researched mistakes in dosage quantities or irresponsible recreational use of psychedelics even more sinister. You may now be wondering why physicians should risk testing the use of psychedelics since we know so little about their long-term effects, and if the benefits even outweigh that of such unfavorable side effects. Well, a movement promoting the study of psychedelics would remove the apprehension surrounding the drugs, whether you're in favor of their usage or not. Additionally, the more research conducted, the more likely it is that psychedelics can have other beneficial uses, beyond their positive effects on the brain.